Hello, this is our role play for our trauma-informed care with a client who is experiencing political violence, seeking asylum, and is a refugee in another country. To do this, I'm going to be using narrative therapy. This client is named Moses Sumi. He is a 25-year-old male. He was in the 1994 Rwandan genocide, and after the month of April happened, um, he walked over to Uganda with his sister, where they have been living in Kampala in the Samaritan's Purse refugee camps. According to the American Psychological Association, a refugee is a person who's outside his or her country of nationality and has a well-founded fear of persecution because of his or her race, religion, nationality, membership in a particular social group or political opinion, and is unable to avail him or herself of the protection of that country or to return there for fear of persecution. So at this time, Moses is unable to return to Rwanda because is his nationality within Rwanda was a Tutsi, so he was under persecution and left his country. His trauma exposure will be correlated with a high occurrence of mental disorders. The most prevalent psychological concerns with a refugee are post-traumatic stress disorder, depression, and anxiety. When working when working with someone seeking asylum or a refugee, there are many things to take into consideration, but there is the relocation process, which will be defined as pre-migration, in transit, and post-migration, and that will be clearly laid out within the use of our narrative therapy, which I'm going to use with Moses, and we are going to be within the stages of rewriting his story. And so we are going to take a look into those chapters and rewrite his story. All right, so let's get started. Hello, Moses. How are you there? How are you today?
I'm doing good today.
You're doing good. Were you able to get some breakfast?
I was, it's not the best type of food, but it is what it is. Um,
Yes.
you know,
Mhm.
Not like my family's home cooked meal like it used to be.
Yes, I understand. So last week we kind of talked about what it meant to re-author your story and to kind of take back some of that control over your life. But this week, what we're going to be working on is rewriting your story and kind of taking a look into some of the things that have happened to you. And what I really want you to focus on is really being able to split up the things that have happened. And because I think in your mind, there are very clear distinctions, and I would love to kind of externalize that and to be able to process those situations with you. So when everything first started happening, that Easter morning in Rwanda, um, uh, that made you fear for your life, that said, I'm in trouble, I should get out. We call that the pre-migration stage. If you could for me, maybe talk a little bit about that chapter and kind of like what you would rename it if you could.
Yes, so when you told me a little bit about it, I decided to name that chapter The Great Takening. The reason why I named that chapter was because that was the moment where I ended up losing my wife and my child. So that was kind of painful experience for me.
Mhm.
Um, Within my country, there's a lot of unrest and there's just a lot of things that are going on. And so, tragically for me to lose both of them, was very hard for me. And so I said the great takening because I felt like, to me, family is a big aspect of my life. And, for my wife and my child, they were very important to me.
Mhm.
And so honestly, for them to be taken away from me, I don't even know what to do.
I'm happy to hear you name that the great takening because it also takes the blame off of you, because I remember for quite a few sessions you were really blaming yourself for not protecting them better. And something that's just always important for you to remember is that in this time of a genocide, absolutely none of that was your fault. And that I know that if your wife and your daughter were here, that they would say that as well. Okay, so so after everything that happened, you know, you decided to pack up and to leave, and you thought, you know, Uganda would offer you asylum and that they would protect you. Now, what would you call that stage where you were in transit? What would you name that chapter where you were on that big pilgrimage to Uganda?
I named that A New Vision. It definitely, with everything that happened with my wife and my daughter, I was in complete total breakdown. So this opportunity to go to Uganda and to experience something new and to, get away from my country, is just something that I've never pictured for myself, nothing I envisioned for myself. And so I think A New Vision is definitely an appropriate title for that part of my life.
Mhm.
Just the opportunity to go, and not even to know what I would experience when I got there.
Yeah, absolutely. That took great faith and great courage. Okay, and so that not final, but kind of that continuing feeling of displacement where you're in that post migration, you've made it to Uganda, but now you're kind of like, what's next? If you could for me, maybe, what would you name that chapter of waiting, that chapter of, can I go home?
Definitely, I named that The Uncomfortable Soul.
Mm-hmm.
Um, Definitely, being here in Uganda has been very, very new. Like I mentioned earlier, I'm not getting the same cooked meals as I used to. Um, you know, Back in my home, like I don't even know if my family's still alive. I've heard a lot of them have died due to the unrest that's happening. And of course, being here, yeah, it's offered me asylum, but moments it's very uncomfortable because
Mm-hmm.
I don't know what to do. I don't know what to expect. So it's something that I'm having to just get used to, and being uncomfortable is definitely an aspect of that of my life right now.
Okay. Yes, I completely see where you're coming from. I know that, you know, you were really well respected in your town back home. And so I know that it's got to be hard to know that you're an expert. And yet at this time, you know, you're uncomfortable. Everything's not the same. You can't even get a job. So I understand the difficulties for that, you know, the situation just seems never ending. So if I could ask you, um, how would you prefer things to be? Like, how would you, what would you do differently in this situation with the cards that you've got? You know, you do have people in your corner, very much so, but how would you prefer things to be moving forward?
Uh, Honestly, I wish I could go back to Rwanda. I wish things were definitely different. Um,
Mm-hmm.
you know, I think I can speak for a lot of people in saying I wish I could have my wife and my daughter back.
Mm-hmm.
That's something I would take in a heartbeat. Um, but yeah, as far as the cards even that I have now, just to be able to go to my home and be able to feel safe, and even if I could find one family member just to be able to experience the rest of my life with, um, I think that's something that's a big big want in my life as of right now. I wish that was different.
Mm-hmm.
Um, I wish I had, better education, to continue to even, work hard and to change some of the things that are happening in Rwanda, um, whether that's to get in politics or whatever it is. But I definitely, and I am, of course, I'm a smart person, but I definitely, those are kind of some of the things that I wish were a little different.
Yeah, absolutely. Well, we're running out of time a little bit, but what I really want to do is just encourage you because you have been sticking it through. You've been doing such a great job over there. I hear that you have been helping a lot of people still coming over, still seeking safety and protection. And so I just want to let you know that you've been doing a great job. And I really do hope the best for you, and that you will be able to go back to Rwanda one day and just to really kind of rebuild everything that was lost. All right. Well, thank you so much for that. Okay, so end scene. Okay, so that was our role play on using narrative therapy of someone who has been seeking asylum of a different country and is a political refugee. And so 3 key points that need to be used when working with someone who has experienced this is that the first one is that the therapist needs to show multicultural respect and dignity for that person, because and in its definition, a refugee is someone from another country. So from that point of view, as from the beginning, the therapist needs to be able to understand where the client is coming from, needs to understand that their values and home life and cultural differences will be very important in the healing process. And so the therapist needs to be competent in working with them. The second key point is that the therapist needs to be non-blaming for the situation. Whether the client had a hand in any of the violence, whether the client had a hand in any of the political unrest, it is very important for the therapist to not assign blame, and for the client to even take some of the blame off of themselves. And the third key point is that the client is the expert of their situation. Coming from another country, a whole other home life, language barriers, whatever it may be, the client is the expert. And the therapist needs to be very well aware of that, especially, even with working with people of different colors, the power dynamics there, in order for that client-patient relationship to be successful. What did I say there? The client-patient relationship? Oh no, the therapist-client relationship needs to be successful. And so the therapist needs to recognize the power dynamics that are in their hand. And the therapist needs to be aware that the client is the expert. All right, well, thank you for coming to this role play. Okay, stop recording.